Hey there, Erin here. I wanted to provide an update about how my dad's been doing. He's been in a nursing home for a little bit over a week at this point after having a seizure event, which we still don't know exactly what it was. Seizure, stroke, something that didn't show up on an EEG, an MRI, a CT, or anything, but clearly and substantially affected his well being and his abilities. He's been at the nursing home since, I want to say maybe last Tuesday, last Wednesday, and it's now Thursday, so over a week. And there have been ups and downs. I'll start with the ups. The place is super cozy. My mom was really worried about finding a place that felt good, and this one does. When we walk in, there's a good feeling. The people there are super friendly, and we've started to get to know them. So all of that's really good. One of the best things is that my dad has been in a good mood. Several of the times we visited, he's been playful. He's been a little bit more talkative. I would say substantially more talkative than he was at home. He's been doing silly handshakes when he sees his grandkids and laughing, dancing, singing, stuff like that. And I think some of that has to also deal with the way his brain must have been affected by whatever happened recently. Because although he's talking, he isn't always understandable. He'll start sentences and he'll stutter a lot and he'll struggle to find words. And sometimes he'll just abandon the sentence, but he acts like it doesn't really bother him all that much that he has to abandon the sentence. Like he'll kind of just shrug 3 or 4 words in, like, this is just too hard. And sometimes he'll finish the sentence and we can't tell exactly what he intended to say, but he'll start giggling or laughing at the end, and we'll just laugh along with him. Like, obviously, that was a joke, and I'm happy he's happy, you know? So those are some of the things that have gone well. He's also eating pretty well. My mom was really worried about whether or not he would eat for other people feeding him because he hasn't been feeding himself since the accident, and we're not sure how well he can see, which would be a real challenge for him as somebody who has previously, relied on his vision for eating. But he is generally eating well. Some things that have been a little bit of a challenge. One of them is that he's not always in that energetic and playful mood, and none of us are, right? But sometimes my dad has had days that were super groggy and super sleepy, and on those days he doesn't really want to eat, he doesn't want to talk. He can be really hard to wake up. It can even be kind of scary to see him like that because you wonder what's going on. But he has come around. He's done well in the rehabilitation with sitting up and standing up at the nursing home, although he hasn't walked since he was at the hospital. So he has stood, but he hasn't walked. And one of the main issues that we faced is that ever since this seizure event or stroke or whatever it was, he has had a lot of jerky movements in his body. At the hospital, it was his hands and his feet. The hands have mostly calmed, but the feet still wiggle a lot when he is laying down or sitting in a wheelchair. And he doesn't like anything over him. Like he doesn't like sheets on him. He'll throw the sheets off or other things that you kind of put on him. And he has experienced a lot of agitation at night. Agitation might not even be the right word for it, but involuntary movement, attempting to get out of bed. They put the bed very low to the floor, and there's a fall mat underneath it. So if he does wriggle his way off the bed, he's at significantly less risk of actually hurting himself by doing so. But he can't get up and back in the bed on his own, and that means that the nurses have to come in and get him back up. And it's a big undertaking because he's a big dude and he doesn't follow instructions and he resists when he feels somebody pushing or pressuring him. So that's caused them at times to ask whether he needs some sort of sedative medication, some sort of sleep aid. And we're still trying to work through whether that's appropriate and what that would mean for him. We've even talked about putting a mattress directly on the floor to make it more easy to get in and out of, if that's what he's going to do anyway. I think the biggest issue that we've had so far has been around his um, uh, catheter. So even at home, my dad would get out of bed a lot at night to go to the bathroom. And that's one of the reasons that my mom eventually had to get a night sitter, because he would need oftentimes to be guided to the toilet and back to the bed. And if he was getting up, 5, 6, 7 times a night, which was not all that uncommon, my mom really couldn't get any sleep and she couldn't help him effectively the next day. The problem would kind of snowball on itself. And the sitter was actually there the night he had the seizure event. But at the hospital, because he had a full bladder at one point, and it may have been due to the seizure, it may have been due to the sedative medications that they'd given him at the hospital, he wasn't going to the bathroom. And he couldn't get up and walk to the bathroom anymore. So I sympathize with the fact that, like, if you're used to going to the bathroom and people start just expecting you to pee in a diaper or to pee in a urinal, and you're not in a position where your brain can learn something new, like, you might just hold the urine in your bladder. And that's what he was doing. He ended up getting a catheter, and he's still had it in, but last night, his fidgeting has often centered around, that catheter, and he pulled it out, and he found himself in the hospital again, dealing with the catheter that he had pulled out himself, which sounds awful, but he was in a good mood today, and he was laughing and cheerful. I get to see him again tomorrow. I think this will be the 4th time that I've gotten to see him, and I'm really looking forward to it, and each day is different. But we're laser focused on his comfort, and hoping to see him regain some skills, hoping to see him heal up, but we're aware that he probably won't return to the baseline that he was at previously. So I'll keep you posted about his well-being. I'm also right around the corner from my next trial event, which is an MRI. So for those of you who aren't familiar with our family story, I am a 41-year-old mother of 2, and I carry a rare genetic mutation that will cause Alzheimer's disease. Likely around the same time my dad got it, which was symptoms beginning in his late 50s. So I am in a clinical trial that aims to prevent Alzheimer's disease, and I have received my first dose of the medication or placebo, because I don't know which I'm receiving. Either way, a couple weeks from now, actually, I'll go for an MRI to determine whether I am experiencing any of the side effects associated with the drug, specifically ARIA, which is brain bleeding. And hopefully that turns out to be negative, and I get to continue with my second dose of the drug, which will be administered during a home visit. I think the week or so following that, if all goes well. So I'll keep you posted about how all that goes. But in the meantime, that's the update from our family. Thank you for rooting for us. I know so many of you have been through this sort of thing before in the past, so I can use any tips you can offer. It's hard, it's hard for all of us, knowing that my dad can't communicate very well verbally, and we don't know what he's experiencing. We don't know how well he can see. We don't know what's hurting him or not hurting him. And it's tough. So thank you for thinking of us, and thank you for any tips you can offer.